When preparing for your licensing exam, it's essential to understand the diagnostic criteria for both PTSD and major depressive disorder. The DSM outlines specific requirements for each, including the duration of symptoms and the types of experiences clients report. For PTSD, look for exposure to traumatic events and symptoms lasting more than 1 month, while major depressive disorder requires at least 2 weeks of persistent low mood and other related symptoms. Because these disorders can share overlapping features, paying close attention to the details will help you differentiate between them accurately. Knowing these distinctions is key to making informed clinical decisions. Both PTSD and major depressive disorder share several key symptoms, including persistent negative mood, difficulties with sleep, and problems with concentration. These overlapping features can make it challenging to distinguish between the two conditions, especially when working with clients who present with these issues. It's important to recognize that while the symptoms may look similar, the underlying causes and context often differ. Understanding these similarities helps ensure accurate assessment and prevents misdiagnosis. Paying close attention to the context in which symptoms arise is crucial for effective treatment planning. Now, let's focus on the key differences between PTSD and major depressive disorder. PTSD is characterized by a clear history of trauma, with symptoms like intrusive memories, avoidance behaviors, and heightened arousal. In contrast, major depressive disorder centers on persistent feelings of sadness, a loss of interest in activities, and pervasive negative thinking. These distinctions are crucial for accurate diagnosis. Throughout this section, we'll highlight real-life examples from clients to help illustrate these differences. Let's consider the case of Sarah, a car accident survivor who now struggles with persistent memories and heightened anxiety. Her symptoms include intrusive flashbacks, avoidance of reminders related to the accident, and a constant sense of alertness. These experiences are characteristic of post-traumatic stress disorder rather than major depressive disorder. Unlike MDD, which is marked by pervasive sadness and loss of interest, Sarah's distress is closely tied to the traumatic event and its aftermath. This distinction is crucial for accurate diagnosis and effective treatment planning in clinical practice. To distinguish Sarah's case as PTSD rather than major depressive disorder, it's important to examine the specific symptoms and their connection to trauma. PTSD is characterized by a clear link to a traumatic event, which Sarah experienced. She exhibits intrusion symptoms, such as distressing memories and nightmares related to the trauma. Additionally, Sarah demonstrates avoidance behaviors, steering clear of reminders of the event, and shows signs of hyperarousal, including heightened anxiety and difficulty sleeping. These features are central to a PTSD diagnosis and set it apart from MDD, which lacks this direct trauma association and symptom pattern. Michael is a client diagnosed with major depressive disorder, or MDD. Unlike some individuals, he does not have a history of trauma, yet he experiences ongoing sadness, a lack of interest in activities he once enjoyed, and feelings of guilt. These symptoms significantly impact his daily life, making even simple tasks feel overwhelming. Michael's story illustrates how MDD can manifest in someone without a traumatic background, highlighting the diverse ways this disorder can affect people. Michael's diagnosis is best classified as major depressive disorder rather than post-traumatic stress disorder. This distinction is primarily due to the absence of a traumatic event in his history, which is a core requirement for PTSD. His symptoms, such as persistent low mood, loss of interest, and changes in sleep and appetite, align closely with MDD criteria. In contrast, PTSD typically involves re-experiencing trauma, avoidance behaviors, and heightened arousal, none of which are present in Michael's case. When evaluating similar scenarios on your exam, pay close attention to the presence or absence of trauma and the specific symptom patterns.